Xerostomia, dry mouth, is an dental disease condition, oral health problem. Look at this picture, shows that dry mouth, cracking in lips and tongue. Look at this. And xylography, imaging of salivary ducts for diagnosis. Detail going on. Introduction. Xerostomia, commonly known as dry mouth, is a condition characterized by a decrease in salivary secretion. Saliva is crucial for oral health as it aids in digestion, prevents infections, maintains mucosal integrity, and facilitates speech and taste. Xerostomia can be a symptom of various underlying diseases or a side effects of medications, and often impacts quality of life significantly. A definition. Xerostomia defined as the subjective sensation of oral dryness resulting from decreased or absent salivary flow. It may or may not be associated with objective evidence of reduced saliva production, hyposalivation. Etymology. The term xerostomia comes from the Greek word xero, meaning dry, and stoma, meaning mouth. It literally translates into dry mouth, describing the primary symptom of the condition. Epidemiology. Xerostomia affects approximately 20% to 30% of the general population, with a significantly higher prevalence in the elderly due to polypharmacy and age-related health conditions. It is also common among patients undergoing radiation therapy for head and neck cancers, and those with autoimmune disorders like Sjogren's syndrome. Types. 1. True xerostomia due to actual reduction in salivary gland function. 2. False xerostomia, subjective dry mouth, no measurable reduction in saliva but still perceived dryness. 3. Temporary xerostomia caused by short-term conditions such as dehydration or medication. 4. Chronic xerostomia, long-term dryness due to systemic illness or reversible damage to salivary glands. Causes: 1. Medications most common: antidepressants, antihistamines, anticholinergics, diuretics, antihypertensives. 2. Systemic diseases: Sjogren's syndrome, diabetes mellitus, HIV/AIDS, Parkinson's disease. 3. Cancer therapies: radiation to the head and neck, chemotherapy. 4. Dehydration due to fever, excessive sweating, vomiting, diarrhea. 5. Nerve damage, especially following head or neck surgery. 6. Lifestyle factors: smoking, alcohol, and recreational drugs use. Risk factors: 1. Age, especially elderly. 2. Polypharmacy, multiple medications. 3. Autoimmune diseases. 4. Radiation therapy for head and neck cancer. 4. Diabetes and other chronic illness. 5. Poor fluid intake or fluid loss. 6. Smoking or alcohol consumption. Complications: 1. Difficulty speaking and swallowing. 2. Increased risk of dental caries and oral infections. 3. Cracking or splitting of lips and corners of the mouth. 4. Burning sensation or pain in the mouth or tongue. 5. Taste disturbances. 6. Halitosis, bad breath. 7. Nutritional deficiencies due to altered eating habits. Pathophysiology. Here is the step-by-step pathophysiology of XEROSTOMIA. 1. Triggering factor. The process begins with an underlying cause such as medication use, example anticholinergics, antihistamines. Autoimmune disorders, example Sjogren's syndrome. Then radiation therapy, dehydration or systemic illness. 2. Disruption of salivary gland function. These triggers either inhibit neural stimulation of salivary glands, example drugs affecting parasympathetic pathways, cause glandular damage or atrophy, example radiation or autoimmune destruction. reduced fluid availability, example dehydration. 3. Decreased salivary secretion, hyposalivation. Reduced function or destruction of salivary acinar cells leading to lower production of saliva. Impairment of mucus and serious acini affects both lubrication and enzymatic functions of saliva. 4. Alteration of oral environment. A decreased saliva results in reduced oral lubrication, increased oral acidity, disrupted antimicrobial action. 5. Mucosal dryness and damage. The oral mucosa becomes dry, fragile, and less elastic, prone to cracking, ulcers, and infections, especially candidiasis. 6. Functional and sensory impairments. Patients experience difficulty chewing, swallowing, and speaking, burning sensation, altered taste, and halitosis. 7. Increased risk of oral complications. Chronic XEROSTOMIA leads to dental caries, gum disease, oral infections. Malnutrition or dehydration due to reduced intake. This stepwise process highlights how xerostomia evolves from a triggering condition to a clinically significant problem affecting overall health. Signs and symptoms. 1. Feeling of dryness or stickiness in the mouth. 2. Thick, stringy saliva. 3. Cracked lips or mouth sores. 4. Difficulty chewing, swallowing, or speaking. 5. Burning sensation in the tongue. 6. Bad breath. Halitosis. 7. Altered taste. 8. Sore throat or harsh senses. Diagnosis. 1. Patient history, medication use, systemic disease, and lifestyle factors. 2. Clinical examination. Dry, sticky oral mucosa, red or fused tongue, dental caries or oral candidiasis. 3. Salivary flow test. A. Xylometry measures saliva output. B. Xylography, imaging of salivary ducts. 4. Lab test. Autoantibody testing for autoimmune conditions like Sjogren's syndrome. Nursing diagnosis. 1. Impaired oral mucous membranes integrity related to decreased salivation. 2. Balanced nutrition less than body requirements related to difficulty in chewing, swallowing. 3. Risk for infection related to dry mucosa. 4. Impaired comfort related to mouth pain or burning sensation. 5. Ineffective health maintenance related to lack of knowledge about XEROSTOMIA. Management. Medical management. 1. Address underlying causes, example change medications if possible. 2. Saliva substitutes, over the counter products, gels, sprays. 3. Salivary stimulants, pilocarpine or civimeline, cholinergic agents. 4. Treat oral infections, example antifungals for candidiasis. 5. Good oral hygiene, fluoride, mouthwash, regular dental checkups. Nursing management. 1. Encourage frequent sips of water and sugar-free beverages. 2. Promote the use of sugar-free gum or candies to stimulate saliva. 3. Educate on avoiding tobacco, alcohol and caffeine. 4. Monitor for signs of oral infection or mucosal breakdown. 5. Collaboration with a dietitian for soft, moist dietary plans. Treatment options. 1. Hydration, adequate fluid intake. 2. Saliva stimulants, sugar-free gum, mints, medications. 3. Saliva substitutes, artificial saliva, oral rinses. 4. Medications, pilocarpine, civimeline for patients with intact salivary glands. 5. Oral hygiene support, topical fluoride, antifungal agents, regular cleaning. 6. Management of underlying disorders, example autoimmune conditions. Psychosocial medicine. 1. Counseling and education to help patients understand xerostomia and cope with long-term symptoms. 2. Support groups, sharing experiences with others suffering from chronic dry mouth. 3. Cognitive behavioral therapy to address anxiety or depression associated with chronic discomfort. 4. Social reintegration programs for those who avoid social situations due to difficulty speaking or halitosis. 5. Nutritional counseling, supporting patients with dry mouth who experience eating difficulties or weight loss. Prevention. 1. Limit use of medications with anticholinergic effects when possible. 2. Maintain good hydration and oral hygiene. 3. Avoid alcohol, caffeine, tobacco. 4. Regular dental checkups to detect early signs of dry mouth. 5. Use of humidifiers, especially during sleep. In conclusion, XEROSTOMIA is more than just a dry mouth. It is a condition that can severely affect oral health, nutrition, and quality of life. It can result from a wide range of causes, especially medications and systemic illness. Early recognition and appropriate interventions, including medical treatment, lifestyle modifications, and psychosocial support, can alleviate symptoms and prevent complications. A multidisciplinary approach ensures the most effective management and improve patient outcomes. Thank you. Have a nice day.